The power of natural supplements for Crohn's and colitis, supporting gut healing beyond medications. If you're struggling with Crohn's or ulcerative colitis, you know how frustrating that can be to manage those symptoms like pain, fatigue, and unpredictable flares. While medications can help control inflammation, they don't always address the underlying root cause of gut dysfunction. And that's where natural supplements come in, the nutraceuticals. Oh, I love those. Functional medicine takes a root cause approach to healing, focusing on reducing inflammation, repairing the gut lining, restoring microbiome balance, which is often not done in traditional medicine world. All critical factors in managing IBD. Here are some of the most effective natural supplements that can support your gut and help you feel better. Probiotics and prebiotics. They help restore a balanced gut microbiome. They reduce harmful bacteria and trigger flares due to that. They support the gut lining and immune function. Look for clinically researched strains like Lactobacillus, Bifidobacterium, Saccharomyces boulardii for best results. I wrote a paper on probiotics, prebiotics, and postbiotics. You could access that online. Omega 3 fatty acids. Powerful anti-inflammatory benefits help reduce gut inflammation and prevent flares. Found in fish oils, flax seeds, walnuts. Studies show that omega 3 can decrease the need for steroids in IBD patients. Think about that. That steroids have side effects, so let's be in a preventative mindset. This can be consumed from nutrition, but often Crohn's and colitis patients are in a greater need of omega 3 fatty acids, and no diet can replace them, or not enough can be replaced without additional supplementation. I often recommend to do micronutrient testing to see where you stand with omega 3 levels, and with my clients, we often do that. L-glutamine. It helps repair and straighten the gut lining. It reduces intestinal permeability, leaky gut. It supports immune system function and reduces inflammation. It's a game changer for those dealing with malabsorption and gut damage from IBD. This powder is often added to combination products. I recommend to my clients to use it separately. And there is a reason for that. And if you happen to have, for example, mood changes due to high doses of L-glutamine, which can happen, speak to experienced functional medicine practitioner who could navigate the situation, because that happens. And I've seen people just dropping the supplement altogether, which actually shows a lot of benefit. There's no need to completely get rid of it. Often, just reducing the dose is important. Um, Next one is turmeric extract, curcumin in the nutraceutical world. It's a potent anti-inflammatory. It's an antioxidant. Has antioxidant properties. It supports gut healing and immune balance. Works similarly to those medications, but with fewer side effects. Medications for pain and inflammation. Yet we have we have issues with a lot of things: medication, nutraceuticals. Curcumin needs to be paired with black pepper extract for better absorption, but sometimes that can be a little irritating for Crohn's and colitis patients. So that should often be added later in the program, not when there's a acute flare going on. So again, working with someone that has been doing this for a long time is important. I've seen this work for some clients, while for the others, it becomes a problem, especially for those with hormone level depletions, too. A good functional test for hormone levels would be a good idea here as well. If curcumin happens to create an issue with periods and maybe spotting during the cycle. So think about testing functional diagnostics. Aloe vera and slippery elm. I see this being recommended often. I have a very big question mark when I hear aloe vera. Again, I've seen thousands of Crohn's and colitis clients, and I've seen a lot of them react to aloe vera. It's irritating for some, but overall, it has a good data on paper. It shows that it soothes and coats the gut lining, it reduces irritation, inflammation. It helps with symptoms like diarrhea and cramping. These natural herbs are gentle, powerful. Yet, I'm skeptical here, and I've seen reactions, even heartburn from aloe vera. Of some of my clients experienced it, um, more than I would like to see. In order, like I need to be able to have a better data to support me saying here's what I recommend. So that for that reason, I usually steer clear from aloe vera recommendation. Vitamin D is the really big and powerful one. It supports immune regulation, gut healing. It has a good data for Crohn's and colitis patients. Low levels are linked to increased inflammation. Therefore, we make sure we support a good high level. Optimal range is somewhere between 50 to 80 for us to have that as a goal. It's essential for those with nutrient absorptions like IBD patients. And we're often severely deficient in vitamin D. So testing and supplementing is the key. Make sure you get the right kind of D with vitamin K and magnesium, boron for best absorption. Next one would be magnesium and zinc. Helps repair gut tissue, supports digestion, essential for immune function and reducing inflammation. Many with IBD are deficient due to malabsorption because there's inflammation, therefore malabsorption. Therefore, ideally, you want to test and see. If not, a good comprehensive formula that gets absorbed well is the key. Well, these minerals play a crucial role in reducing stress of the gut and preventing flare-ups. And healing gut naturally is very important. The concept of give me the pill, I don't think it no longer persists. Just this is way too easy to not incorporate into your routine to have a better outcome, even with medications. Natural supplements can be powerful tools in your Crohn's and colitis healing journey, and they work best when combined with anti-inflammatory diet, with stress work, stress management techniques. Identifying, eliminating your food triggers is important, and proper functional lab testing. Have you tried natural approaches to Crohn's and colitis? What has worked for you? Drop a comment below. And this is Dr. Ina with you at Digestive Reset and Melamed Institute. I take clients to help them with Crohn's and colitis. I have a best-selling book, Crohn's and Colitis Fix, and I could send it to you for free. You could upload it on my website or drop a comment that you want the book. And if you're ready for personalized gut healing plan, we could get started into one-on-one or a program for a group. Dr. Ina with you at Digestive Reset and Melamed Institute, and until the next time.